Explaining the past declines in infectious disease mortality. As Ryan Hum mentioned in the previous lecture, there has been substantial declines in childhood deaths, mostly from reductions in infectious disease deaths over the last 100 or so years. What gave rise to these dramatic decreases? Well, you have to look at that separately for the time period before 1950 and the time period after 1950. So prior to 1950, much of the improvement came from understanding very basic things about the transmission of various infectious diseases and early vaccines that were rather crude but could still be very effective, paired with simple measures such as quarantine and similar public health approach. And let's consider a few. Schemmelweiss and Holmes, two researchers, independently found that simple hand washing during the time of childbirth could decrease puerperal fever, or what's called puerperal sepsis, which is a very nasty infection that can kill a mother and a child very quickly right around the time of childbirth. Doctors and nurses washing hands in between treating each of these patients substantially reduced mortality. Similarly, there were other efforts that identified the transmission, for example, of measles. And this led to very basic efforts such as public health quarantine that was used quite widely. A similar example is looking at early vaccine, in particular the smallpox vaccine that actually started very early in the 18th century to be used. And this was called the Jenner vaccine after its inventor or its discoverer. And what Jenner did is take the smallpox variation of infections in cows and slightly make them less virulent or less infectious and use them in humans to try to prevent the acquisition of actual smallpox. And this vaccine was used quite widely throughout England and in Europe. And in fact, in the late 1800s, the smallpox vaccine, the Jenner vaccine, was used in Bombay, India, to reasonably high coverage and seemed to have reduced smallpox cases in that population. So this is an example of early diffusion of these very basic knowledge around transmission and very early vaccines. Take a look at slide 2, which describes the changes in the American Public Health Association questionnaires that were sent to American cities. They focused on various cities and asking them what they were doing in the way of their public health practices. So you'll note in 1875, the questionnaire had items such as gas and lighting and cemeteries and burial grounds, location, climate. But by 1921, the questionnaire had very much shifted to what was already emerging as key public health principles, such as infant hygiene, including hand washing, understanding contagious diseases, milk, and particularly the pasteurization of milk, which is already available to decrease infections from unpasteurized milk, as well as vaccination rates and laboratory rates. So this was the story before 1950. But after 1950, the story is very much one of use of biomedical interventions. Specifically, this involved a lot more research to create the modern vaccines that we use today, for example, to protect children from various diseases. The extended program in immunization started only in the late 1960s and meant to raise the percentage of the world's children who are vaccinated from a very low level of 3% to much higher. And today, over 85% of the world's children get the basic vaccines, and that has saved millions of lives. The stellar example, of course, is smallpox eradication. And prior to smallpox eradication, at the peak, smallpox used to kill about 3 million people a year. In fact, one of my grandmother's 12 children was killed by smallpox at the age of 3 in the 1930s in India. Smallpox was eradicated using a campaign of what's called ring vaccination, where they found a case and everyone exposed to that case was vaccinated very quickly. And this led to elimination of the virus by the late 1970s. And there are other examples which now extend to treatment, the most famous of which is oral rehydration. This research was done in Bangladesh and involves simple homemade remedies that combined some sugar, salt, clean water, some bicarbonate, and combined together they provide a life-saving fluid that can be given by the mouth to children who otherwise would have died of severe diarrhea. So today, and looking forward, if we think about life-saving interventions for infectious diseases, but also for chronic diseases, they really will be of the biomedical nature. They'll involve drugs, vaccines, in some cases diagnostics, and as you'll learn later, even some policies, such as those for reducing chronic diseases.
We've talked a lot about technology so far. You brought up hand washing, public health measures, vaccinations, penicillin. There's a lot of talk about other factors. Thomas McEwen had a thesis that it wasn't any of these things. He basically said that the invention of some of these key technologies happened after the declines in mortality happened. Yeah. How do you explain that?
Yeah. That at first cut, you're right. What McEwen has shown, that famous graph where he showed TB deaths were going down well before TB drugs came in.
Exactly.
Refutes what we've been talking about. But you have to look at that a little more carefully. So first of all, the declines in TB might have well been related to improvements in standard of life expectancy or improvements in the standard of living, less crowding and less transmission, and other factors such as improved nutrition. The important part of the McEwen's graph is really at the tail end. If you see the declines, they really accelerated after treatments for TB became available. And what that suggests is that today, if you really wanted to knock down TB, you would use treatment as the way to do so. You wouldn't have so much emphasis on trying to look at the factors such as crowding and broad improvements in nutrition. So McEwen is both right for his times, but in the modern era, the bet still is on modern approaches to reduce things like TB mortality.
So we were doing the best that we could before the technology, and it was really having an impact.
That's right.
But the biggest impact happened after the technology was
That's
forward.
That's right.
Okay.